All right, welcome everyone. This is the Region 2 presentation for NNLM at MLA Day. We are so glad that you are here with us today. I'm going to get into some introductions. We're going to talk about what's been going on in Region 2 and talk about some of our plans for year 2. So welcome. All right, so to introduce myself, my name is Lauren Jackson. I'm the executive director for Region 2. I'm also our state liaison for Mississippi and the Commonwealth of Puerto Rico. Those are my pronouns and also my email address. And just for the folks that are here today, if you don't mind putting in the chat where you're from and your name, and if you want to, your title or the organization that you're representing, we'd love to see where folks are coming from today. So please do that while I go through the initial introductions in the presentation. So let's back up a little bit and talk about sort of the hierarchy for the different programs that we're a part of. It all starts at the highest level with the National Institutes of Health. That is the nation's research agency with 27 institutes and offices. Beneath that is the National Library of Medicine, which is the world's largest biomedical library. And then nestled into that is the network of the National Library of Medicine, of which we're a part. The network is a program comprised of 7 regional medical libraries, offices, and centers. You'll also see those referred to as ROCs or RMLs in abbreviations. And also the RMLs, of which Region 2 is one, offers education and funding opportunities. All of us do. And we support equal access to biomedical information. That's our central mission. Wonderful. Thank you so much for putting in the chat. I'm seeing Florida is representing, Georgia, Tennessee, welcome. South Carolina, ooh, Mississippi, wonderful, good to see you. And I see some of my teammates are in there too. Thank you so much. So also throughout the NNLM, we have different offices and centers. These are the main centers and also the offices with their abbreviations, because again, there are so many abbreviations. So we have the National Training Office, the National Web Services Office, the National Public Health Coordination Office, the Office of Engagement and Training. There's 2 centers for all of us, the Community Engagement Center, and then the Training and Education Center, the Center for Data Services, and the Evaluation Center. So you can see we have lots of different places represented, different states, and then what the abbreviations are here. Who do we serve in Region 2? So we have different states and territories: Alabama, Florida, Georgia, Mississippi, the Commonwealth of Puerto Rico, South Carolina, Tennessee, and the US Virgin Islands. We are located at the Medical University of South Carolina, and that is in Charleston. So that's mainly where Region 2 operates out of. Our startup team is these folks here. So we have Shannon Jones, who is our director and also our PI or principal investigator for this grant. We have Heather Holmes, who's our program advisor, Monique Hill, who serves as our health literacy and partner engagement advisor, Jean Gidenas, who's our DocLine advisor, and Eric Lemon as our technology advisor. So these folks really helped hire me and the rest of our team, and we're the architects behind the cooperative agreement for Region 2. The administrative team for Region 2 has Erlisha Lumpkin, she's our program assistant, Isaac Sherry, who is our US Virgin Islands and Commonwealth of Puerto Rico state liaison, as well as our grants administrator and office manager. And I've introduced myself. Let's introduce our strategist, Sarah Fisher, who is the state liaison for Alabama and South Florida, and is also our community engagement and outreach strategist, Deanne Brame, who is also helping with today's webinar. Thank you, Deanne, and is the state liaison for Georgia and is our technology and innovation strategist, Elizabeth Roth, who is our state liaison for Tennessee and our research and data science strategist. And last but not least, Deborah Trogdon Livingston, who is our state liaison for South Carolina and North Florida and our user experience and education strategist. So now I'm going to talk a little bit more about some of the big picture items in terms of what's going on with the NLM and then specifically for Region 2. So just to kind of review, and I know Martha talked about this in her presentation, but the NNLM initiatives for 2021 to 2026 are these three: confronting health misinformation, bridging the digital divide, and also thinking about environmental determinants of health. Let's talk about some of the year one highlights for Region 2. So our major theme for year one was assembling the team and launching the project. So one of our central goals was to establish a regional medical library for Region 2 of the NNLM at MUSC in Charleston. So all 7 of us were hired for the folks that I introduced on the earlier slides, and we've started working together. We moved to Charleston. We have also really invested in a lot of professional development for our team to ensure that we're working together and know how to deliver the programming in a way that is efficient and ultimately connects people to trusted health information. So that's really what we're trying to do. And part of doing that was making sure that in year one, we established a multi-pronged bidirectional communication and engagement strategy. So we really focused on communications, setting up our social media, making sure that you're hearing from us, that we have our own internal structures for communication with we have an internal staff newsletter, and then we have an external one, actually 2 that go out monthly for all of our members. So one is called The Pulse, which is where we are sure to bring in important updates. I usually give a message from the ED. There are upcoming trainings and programs and things that we want you to know about. And then we have another digest called the Pulse Digest that has been going out semi-regularly every month, that gives you upcoming trainings and professional development that we can support you with funding from Region 2, just to make you aware of those. We also established 2 governance boards in year one, which has been very exciting. They're both advisory boards. So we have the Regional Advisory Board, also abbreviated as the RAB, where members from across our region help us with deciding on what the priorities are and how to make those things happen through their networking and expertise. And then we also have the emergency response, and that's focusing on advising around disaster preparedness and preparing us for that. And that one is still getting up and running, but we are very excited to have both of these established in year one. Another major highlight of year one was membership and the Civi Cleanup Project. So Elizabeth Roth from our team really led the charge with Deanne Brame to make sure that we were working together to clean up our membership and make sure that it was correct in the system that we use with Civi. And that was very exciting. And we shared a lot of our best practices and what we had learned with the rest of the network, and we were really encouraged to do so because it was so successful. So we're really excited that we were able to do that as a new region. We also collected a lot of really positive training feedback from our participants with a lot of our initial programs, and we're trying to use a data, evidence-based research model in terms of making sure that we're meeting those needs as we move forward with our education programming through upcoming years. So after year one, but we got some really amazing feedback from year one. So just kind of a snapshot of our membership in year one. We had 1,319 member organizations. That includes 44 new members and 33 regional medical library activities. And we had over 1,900 participants in our classes and trainings in year one. And our top class was an evidence-based practice virtual webinar series with actually 2 librarians from our staff at MUSC. It was very highly attended and really tried to meet the needs of our members in terms of what they wanted to see. And it was a 3-part series that was very successful. Let's talk about some of our funding in year one. So the range of awards started at the low end at 1,964, and those were usually for exhibition projects or for professional development funding. Those are short-term projects and usually don't require as much money, all the way up to an award that was for $49,890. So we had a pretty wide range, but that was the range of funds. We had a total of 14 that were funded as subawards. So 9 projects were awarded and 5 professional development awards. And we had 16 sponsorship awards. So those were you know, with supporting different efforts like the National Black Nurses Association, like we gave sponsorship towards them for their activities. Our awarded states and territories span from Alabama, Florida, Georgia, Mississippi, South Carolina, Tennessee, and the US Virgin Islands. And we definitely want to increase this representation for our awards in year 2 and beyond to make sure that we're highlighting all of the areas within our region. So this picture is one of our first retreats that we had as a staff. So you can see all of us there when we were finally able to meet in person because of the pandemic. It took some time, but it was really lovely. And it was one of the first times that we worked together. So I wanted to highlight this picture and share it with you all. Some of our program highlights include reporting check-in meetings. So we've had a couple of these, and it's been really lovely to have the opportunity to meet with our subawardees and answer their questions and make sure that we're touching and checking in with them about their needs. That was definitely a goal and a priority for us. So we're very excited that we've been able to do that. And we've gotten really positive feedback from our members that, you know, they appreciate that high level of engagement that we have with them. We also had office hours that Isaac really led the charge on, where, you know, we were working together to make sure that we had standing hours where folks could drop in and ask questions as they needed regarding what was going on with their grants or with the application process. And we really pride ourselves on supporting our members from the pre-stages of applying for funding all the way to post, right? Like with the assessment and evaluation. So that was a successful program. We've made some modifications to it moving into year 2, where we ask people to submit through 2 different channels. You can either submit a contact form, which I'll give you the link for, or you can email us. And then as state liaisons, we will set up with you to find that time that you need to be able to meet with us to answer any questions that you have. We also established our communications plan, which I mentioned in terms of that social media outreach and the frequency of getting the word out to you so that you know what's going on. We started on our state liaison model, and I explained to you, you know, who represents what areas within our region. And we're still kind of fleshing that out, and that's more of a goal for year 2, but we're very excited to have, you know, liaisons that you can work with and make sure that we're checking in with you, especially once you've become funded, to make sure you're meeting deadlines and your milestones to help you be successful, which is our ultimate goal. And we're also interested in increasing accessibility. So this is a theme, I think, across a lot of RMLs and ROCs, is to think about how to make our, especially applying for funding process, more easy and seamless so that, you know, anyone from a variety of backgrounds is able to participate and take full advantage of the funding and training resources available to you from Region 2. Moving into year 2, some of our focus areas are emergency and disaster preparedness. So, you know, really focusing on that with our governance board and making sure that we are prepared as much as we can be for disasters. You know, if you stay ready, you don't have to get ready. That's what we want to do. We want people to feel prepared and have that support from us. That's also related to the second point, which is strengthening our our governance structures, making sure that people understand what their role is, right? Role clarity, making sure that we're leveraging the amazing people that are a part of our governance structures, thinking about if we need to introduce additional ones. That's what we want to focus on in year 2. We're also interested in increasing our exhibitions and conferences and site visits. All of Region 2 will be at the Medical Library Association conference next week in New Orleans, Louisiana. We're so excited. Let me also give a shout out to our director, Shannon Jones, who's the incoming MLA president. We're very excited and proud of her for that, and excited to be represented Region 2. So we're, yeah, that's great for MLA, and we're glad to be here too for today. And then last but not least, we will be having a NNLM internal summit for the staff, and MUSC is very excited to host that in Charleston. People will be coming in the summer who are able to attend, and we're looking forward to that in year 2. So apply for funding with Region 2. We have our second year grant cycle opening It's actually already open and you can apply. Applications are due by May 16th at 5 p.m. So please apply. If you have questions, you can reach out to us and I'll give you the contact information, but we certainly encourage you to apply. You can view and apply for all funding at this website here on our LibGuide with /RML funding. And yeah, we really encourage you to do so and take advantage of the funding with Region 2. Oh, already talked about that. Going forward. Okay, so get involved. So if you are not a member, we definitely encourage you to become a member and get a gold star. Yeah. So please apply, and it's free to join. The website is there. We can certainly help you if there's any confusion with that. And again, we want you to really encourage you to apply for funding with that website. So we're really coming to the end of my presentation. I just have a couple more slides, but I want to thank you for listening to my overview. I wanted to make that short so we could hear more from you. These are the ways that you can contact us. We have a contact form. The link is there, nnlm.gov/region2connect. Please visit our website to learn more at nnlm.gov/about regions region 2. You can find us on Facebook, Instagram, Twitter at our handle NNLM region 2. And then we encourage you to check out our Pulse newsletter and get signed up there. So now I have questions for all of you. That was really all that I had to say. And here are some questions, and you're welcome to unmute or raise your hand or drop it in the chat if you like to answer these. But some questions that I had were, how can Region 2 support you and your organization? What activities would you like the NNLM to offer to meet the NLM initiatives that I explained earlier on, the top 3? What other activities and projects would you like to see in the coming year or beyond? And also I had a question about what values you would like to see us implement and use in Region 2. So thank you so much. And now I am available for questions. Don't everybody talk at once. Feel free to jump in. Anyone have any questions, comments, concerns, ideas? Happy to hear from you. All right, I see one question in the chat that came to me. For those who have submitted for an award, when will they hear back? Yes, so the deadline is May 16th. We give folks time to apply up to that deadline, and then the 2 weeks following that, so the week of the 16th and then the week of the 23rd, we will look at all of the applications and get back to folks, I would say, by the end of May. So because ideally we want you to be able to start with your grant in July, early July is when we'd want you to be able to begin executing the project. So I would say by late May, you should hear back because we want to give everyone time to apply by the deadline. I hope I answered your question. Thank you, Nikki, for that shout out. We appreciate it. Yeah, but if there's anyone from my team that wants to say anything, anything that I missed, please feel free to chime in as well.
Hey, Lauren, I don't have a question, but I just wanted to ask everybody that is here to just offer you all a round of applause because we are the newest RML in the NNLM family, and it took a lot of effort to get us here today. And the team has been working so hard, and they hit the ground running from day one. And we literally came from nothing to build something for the region. And we want to be the best RML out there. We already think that we are, but we need your help in helping us to be the best for you. So if there's any questions that you all have, any feedback that you want to provide, you know, the team wants to hear it, because again, we're trying to be the best RML out there and to meet your needs. And we know that your needs are very different depending on what state you live in, whether you are rural, whether you live in urban areas, depending on what populations you serve. And so we can only offer you the best program and customize our services for you if y'all talk to us. And I know some of the people on this call, and I know y'all are talkers. So if you have questions, you can put them in the chat box or directly, you know, take yourself off of mute and ask them. But give them a round of applause, because they've been working hard to get this up and running, and to make sure that we were building upon the engagement and the service that you all were accustomed to from Southeastern Atlantic. So I just want to, you know, give them a round of applause, because they've been doing really good work the last 8 or 9 months, almost 10 or 11 months rather.
Thank you so much, Shannon. We really appreciate that. And it's true, we have come a long way, long way. All right, Deborah.
Hey.
You have your hand up, Deborah?
I do. Sorry, it took me a minute to unmute. I am always excited to promote good things happening in our region and to talk to you guys. We have a question after I'm done as well, but I wanted to promote that we have a really wonderful webinar coming up. We are going to be talking about dental equity. We have a really great speaker, Dr. Eleanor Fleming, and she's going to be talking about tackling inclusivity and the future of oral health. And I'm going to drop that registration link for you guys in the chat. But I also wanted to give a shout out that I know a lot of you guys are experts in your field. So please remember that something that you can do to help our region is step up to be a potential expert speaker. And we're very fortunate enough to be able to give an honorarium, and we would be really excited to have you involved. Also, I'm always curious how you guys like to be contacted. What's your favorite social media? What time of day is best for programming? How can we best get this information for you guys? So if some of you guys feel comfortable speaking up about that or popping it in the chat, that would be wonderful. I just wanted to say I'm really glad you're here. We're always so happy to engage with our awesome Region 2 folks.
Wonderful. Thank you so much, Deborah. And Mary Ellen, I see your hand, and then we have some questions in the chat. Mary Ellen?
Hi, Lauren, I hope this is okay to share here, because I know I shared it in our meeting a couple weeks ago, but just for the ears of all the guests, I really am interested with working with the leadership at Region 2 to get federal money for data management and training, particularly for students, but also data management projects. I feel like I see a lot of grants coming out of the NIH, but from my knowledge, now there might be something I don't know, but from my knowledge and what I'm seeing, it seems like they're geared toward researchers, and I don't know how it's all going to pan out. I think the world's really changing, but I just think we have an opportunity to work together and try to strategize, and maybe talking with some of those program managers to see how we can work together and get some projects together that would advance the mission of the NIH and NLM. And I know you've all heard that from me before, but I just wanted to share that again since you're asking for participation.
Yeah, that's wonderful. Thank you, Mary Ellen, for that reminder. And yeah, we definitely encourage people to reach out if you're interested in getting involved in that way, like what Mary Ellen suggested. So thank you for that. And she's also a member of our regional advisory board. So that was one of the reasons why I think she wanted to speak up about that. So we have a question in the chat. Can you use funding to pay for giveaways or food, such as a focus group with lunch or dinner? Isaac, correct me if this is wrong, but I believe we cannot support food. We can't pay for that, but there might be other things that we can do, within your grant, in terms of giveaways, or we can think with you and brainstorm how we might be able to, work with a local organization that might be able to donate food for you or space or something like that and get creative. Do any of my colleagues want to add to that question?
You are correct, Lauren. No, we cannot provide money for food or giveaways or giveaways. And yeah, I think it's that simple. We cannot do that on the grant. unless if the project is doing a food project, or like
Right.
where they apply for it and where they give the budget and the justification. Other than that, we cannot pay for food.
Yep. Yeah, and that's just the federal rule. Thank you, Isaac, for that clarification. We got a shout out to someone in Tennessee that met with, I think, Elizabeth and Rachel when they visited for Tesla. So thank you for mentioning that. This is their health science libraries in Tennessee. Do funding opportunities open again in the fall, is a question in the chat. That will really depend on how we do with our funding for this cycle. We're thinking that we will offer funding again throughout the grant cycle year, but it'll depend kind of on how we do with this first round. So we're kind of playing it by ear, but we'll be sure to notify you when the deadlines change or if there's another grant cycle. Yep, people are impressed with the new team. Thank you. Shout out to Sarah for being helpful. There is a link in the chat to register for Tackling Inclusivity in the Future of Oral Health, that upcoming event. Please do so. Getting some more shout outs, which is great. And another question, as a medical library, we are always looking for partners who are more closely connected to the community. Would you consider performing some kind of networking matchmaking service between public libraries, community orgs, and medical libraries? That sounds great. That sounds really exciting. I like that suggestion, Margaret, and I wonder if our regional advisory board can support with that, with maybe a project like that. So thank you for that suggestion. Can you speak to the Region 2 sponsorships for MLA webinars, as well as some of the specializations? Deborah, do you mind taking this question?
I do not. We do sponsor both Medical Library Association webinars that you can take live, as well as we give MLA CE credit for our programs that we put on in the region. So if you guys have particular ones you're interested in, let me know. We're in the middle of, I haven't gotten to really address that with the team, but we're in the middle of like rethinking how we do that. So please contact our team if you are interested in a particular MLA webinar, and we can support getting tickets for that. So please contact us in that way. And then through our funding, we can support you guys. The NNLM can support you getting certification for being a data specialist, emergency and disaster, CHIS programming. There are several different ways that you can get specializations, and we will pay for that. There is a form that will drop in the link. So if that's something you're interested in, we'd love to support you in that, as well as a lot more of your professional development. Did that answer your question, whoever asked that?
Great, thank you, Deborah, for that. So we got some feedback that afternoon programming people like. So for our town halls and for our trainings, we will keep that in mind for sure. Thank you for that feedback, because we've been wondering like what would work best for you. You'll also notice in the chat that I dropped some links to links that were from the presentation today. So you can find that in the chat. Also a link to the presentation slides and our one-page annual report. It's actually about 2 pages, but all of that is in the chat for you if you'd like to download it and see it. Heather also let us know the newly established Data Management Center is offering internships for students and funding too. So you want to keep that in mind. And great. Okay, wonderful. Other questions or feedback? We would love to hear more from you while we have you.
Lauren, one other thing is that just for the attendees is that we know that there's several library schools in our region, and we definitely want to build connections. So if you all have any connections with the library science programs, that would be helpful, and we would love for you to help us make connections. We were able to fund a variety of members who were not able to attend the virtual MLA virtual conference to attend, and several of those were students. And we would like to do more of that, but we also would like to connect with our student members a little bit more too. So if you can help us get connected, we'd welcome that.
Great. Yeah, so are there particular things like other sorts of initiatives or things that you would like to see us do in Region 2 that maybe we haven't yet? Because we're right at those beginning stages of thinking about year 2. So this is a wonderful time to think about, you know, what other things we can do and what other things we can offer you all. You're making me think that my presentation was that comprehensive, and I feel like maybe there's more questions. But yeah, I think that this is a great opportunity. We do hope that you will reach out to us at MLA, you know, if you're going, or even if you're there virtually, if you want to send us an email, let us know how it's going. We would love to hear from you. We're really looking forward to year 2 and moving beyond. We feel like we covered a lot of ground in year 1, like Shannon was saying, but there's, you know, a theme throughout the NNLM is continuous improvement, and we want to be sure that we're meeting those needs as we go. As Shannon said too, like we have come a long way, but you know, we have a ways to go too, and there are things that we know that we can do better, and you can really support us in doing that. Thank you, Aaliyah. I see a comment in the chat. Thank you for your openness. I'm just beginning to get more involved myself. Yeah, so I think it was great, you know, to hear questions from you, Aaliyah, at the town hall. She really helped us with the engagement at our town hall meeting to, you know, answer questions and think about like what funding looks like and what the process is. So we love having you as a member, and we really appreciate your engagement. So we have another question. Thanks for the link to the specialization application. Will that include the new SR specialization as well? Deborah, do you mind speaking to that?
I am actually looking for that answer right now. If you guys could give me just a minute, I'm kind of hunting for you.
No problem. Thank you. We will put that on hold. Yeah, great. Okay, I have a question for the group here. Are there people who are speakers like Deborah mentioned that you think we should invite to speak or to give a presentation? You can put it in the chat, maybe drop their link or unmute and tell us about them. And I see Deborah's hand. Go ahead, Deborah. Oh, Deborah, you're muted.
I hit the camera instead of the mute. Sorry, friends. So I just got confirmation that indeed that specialization, that SR specialization will be included. So if that's something you're looking into, let us support you. And Lauren mentioned putting into the chat, if you have speakers, think about what you want, because we want our education program to reflect what you guys need and what you're interested in. So think about what you wish we offered and let us know. And if you can't think on the spot, I'm one of those folks who kind of needs to ruminate and think about things, then please feel free to reach out and let us know those topics and speakers, you know, help us find out what your interests are, and we'd be excited to do that. And I'm just going to give a plug. We will be at MLA, but we are now on the road, and so we're hoping to meet you guys. So if you see our faces, we would love to meet you. If you see us at MLA, if you see us anywhere, please take a moment and say hi. We would all be very happy to get to know you better.
Great, thank you so much, Deborah. And I'm seeing some suggestions coming through. Thank you, Tracy. That's wonderful. Other suggestions or other themes that you'd like to see, please drop it into the chat and let us know. Wonderful. So we see interest in outreach to previously incarcerated people, definitely an important population that we would like to work more with. So thank you for that suggestion as well. We can definitely think more about that. And while we are sort of thinking about different initiatives, there is an NNLM committee that Shannon and I are on that I want to mention to you all if you have not seen it. It's the NNLM Reading Club. So let me put this into the chat for you. Here we go. So every month we select different topics sort of based on, you know, different health initiatives monthly. And for April, the theme had to do with genetics. And so there's a theme here and a kit that you can use by visiting that website. And it's basically like a reading club in a box. So, you know, you can go to this website and download different resources and ideas, including discussion guides that we create or we find for you about these different topics. And we encourage you to have these, excuse me, at your different community center sites. You know, your like a reading club could be at your institution if you work at an academic institution, community groups, faith-based groups. So we just want to encourage you to use these resources. Like I said, the theme for April was genetics and more like family health. The theme for May is going to be caring for Black mothers. So we have some titles for that, and that should be released in the next couple of days. It will be updated on this website for May. Great, we see another suggestion about the Fannie Lou Hamer Cancer Foundation that was founded by Freddie White Johnson. So thank you for that information, Tracy. That's great. We will definitely make note of that. Thank you for the chat, Tanisha. We've done a few virtual book clubs using titles materials from the NNL Reading Club. Great. How was it? How did it go? Would you mind unmuting and telling us a little bit about it?
Hey, good afternoon, everyone. We ended up using, the first one we used was The Immortal Life of Henrietta Lacks. We also used Black Man in a White Coat and Becoming Dr. Q, starting to supplement or support some DEI activities at our system. And so the book clubs were kind of like to keep the conversations going. We were able to invite people from around the country because everything was done through Zoom, and we got lots of great discussion and participation. So thank you so much for the materials, the kits, everything was really helpful.
Thank you so much for that feedback, Tanisha. I will definitely take that back to the group. I'm glad that it was useful. We want people to use it. So that means a lot to us to hear from people actually putting it, you know, into practice. So that was great. Thank you. Yeah, so are there other topics sort of related to those, you know, 3 NLM initiatives? And I was gonna pull up the slide again that we're focusing on. So we've got environmental determinants of health, bridging the digital divide, and confronting health misinformation. Are there topics within that or related that you would like to see Region 2 have some programming or services about? You can put it in the chat or unmute. Yeah, kind of in thinking about Deborah's comment, I want to give you some thinking time, but for sure, you know, with these 3 NNLM initiatives, confronting health misinformation, bridging the digital divide, environmental determinants of health, are you seeing these play out in your respective areas, like where you are? Are there ways that maybe we could approach these 3 initiatives that you can help us with and partner with us on to address? These are the types of questions that we were hoping to hear answers from you all today, and really appreciate your feedback. Okay, well, if there's no further questions or comments, thank you all so much for, you know, coming to this day, for the update, for learning more about Region 2 and the NNLM. I'll hang back if you have any questions, but other than that, I think we can close early and give you back some time. So thank you again for attending, and we look forward to hearing from you.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.